my Beyond the Care podcast family. I am your host, Dr. Paula, and welcome to another episode of the Beyond the Care podcast. Today, we're going to hear from Dr. Nerissa Dix. Dr. Dix is a licensed professional counselor and mental health clinician. I came across Dr. Dix on Instagram where she shared the story of her father who had dementia and was lost in the woods for 5 days. So I'm excited to introduce Dr. Dix to you, and she will share her experience with her father with dementia, as well as her clinical experience as a counselor. She's a wealth of knowledge and resources and information, and I know that something that you hear today will speak to you. Something will resonate within you as you go along your caregiving journey. So, my Beyond the Care podcast family, take note, listen, and as always, thank you for supporting the Beyond the Care podcast. Welcome, my Beyond the Care podcast family, to another episode. So today we have Dr. Nerissa Dix. Welcome, Dr. Dix.
Thank you. Glad to be here.
I'm so glad to have you here. So let me just read a little bit about your bio. Dr. Dix, LCPC, LPC, NCC, these are all the credentials,
All the letters.
the letters behind the name, is a licensed professional counselor, multi-business owner, and community wellness advocate with nearly 2 decades of experience in mental health leadership, clinical practice, and organizational consulting. She is the founder and clinical director of Nurturing Possibilities, LLC, a growing group mental health practice consultation firm focused on sustainable care, leadership development, and emotional wellness. Last year, in 2025, Dr. Dix used her social media platform to rally a group of 50-plus volunteers across several states to join together to help in finding her father, who was lost in the woods for 5 days experiencing dementia. Wow. Dr. Dix is also the co-founder of Dindy Coffee Company, a purpose-driven coffee brand rooted in community connection, the type of connection she credits for finding her father last year.
Mm-hmm.
The coffee brand was created as a reminder that rest, reflection, and ritual matter just as much as productivity. Yes, girl. Dr. Dix is a national trainer and speaker on burnout, boundaries, scaling with integrity, and building businesses that support, not sacrifice, mental health. Her work emphasizes that true growth requires internal clarity, honest self-assessment, and environments of peace long before expansion. Woo! All right now. Well, welcome again.
Thank you.
So let me just say, I guess was introduced to you. I don't know how I came across your video. This was I just looked it up earlier. This was in September. I came across one of your videos where you were talking about your father who had dementia and he was lost.
Yeah.
And then I started looking at your videos on Instagram. This is on Instagram, you know, that algorithm. I started looking at your videos, and this might have been like in the middle of the night. And I remember messaging you and saying, I'm starting a podcast. My mom had dementia. You know, I want to pour into caregivers. I need you to come on my podcast. So here we are, 6 months later, and I'm so happy to have connected with you. So thank you for being here.
Yeah, thank you for the invite. I'm excited about it and glad you were able to find me in that way. Yeah, definitely.
See, things happen for a reason. So
absolutely.
So tell us about, so I was all into the videos, very intrigued with the story with your father. Tell us about your father, dementia. I want to hear about him being lost in the woods and how he was found and all of that.
Yeah. Well, thank you for inviting me. So my dad, Woodrow Snyder Sr., my father has been experiencing dementia for close to 10 years. And that's the thing with this disease, that some people, their symptoms progress very rapidly and others a little slower. So my father, over the last couple of years, my younger sister and I have been trying to get my mom to get more support as far as taking care of my father, because she was running a childcare full time, and we saw that his symptoms were getting worse.
Mm-hmm.
But another thing about just being a caregiver is sometimes it takes us a little while to really admit that things are as bad as they are. And with dementia, we see like these little glimpses. I know you've seen it, saw it with your mom. We see these little glimpses of familiarity, little glimpses of what seems like normalcy. So we think like, okay, maybe it's not that bad.
Right.
With my dad, we started seeing over the last couple of years that, especially when it gets hot outside, this guy likes to go walking. And as we were growing up, he would take us on walks to a particular park nearby their house. My father was in the military, very fit. He did different things in the military that required him to go into the woods. He was in the Navy. And so he has a lot of athleticism, we'll say, in those bones of his. And my younger sister and I started paying for care. We would go in rotation. I would watch him. My younger sister would watch him. My daughter, even, who just turned 18, would take shifts with watching him to try to support my mom. And one day last year, this was in July of last year, my mom asked me to watch him so she could go hang out with some friends and have just a nice dinner with her friends. So I went to the house with one of my sons, and usually my mom has the alarm system on so that when the door opens, you hear that chime that comes on. This particular day, because she was on some calls early in the day, she had turned the volume down on the alarm system. So my father was upstairs in his room and I was 2 floors down. Now there's an open door. So I thought, if he comes down, I could hear him. And I did not. And my father came down. I went and checked on him, talked to him. And he was like, where's your mother? He kept looking for my mom. So he started his way back up the steps and I started my way back down the steps. And my son said, Mommy, I think Pop left out the house. So I went to go look for him, went up to the room looking for him, looked all around. My father was nowhere. So I started walking towards the park where he usually goes. It's not even a mile from their home, but I had my younger son with me. So I go back to the house with him, get in the car, go down to the park. By this time, my father was nowhere to be found. So by the time my mom got home that evening, the police were already there. Now, my father has done this before, where he went and walked to the woods and we would call the police and he would come back in a couple of hours, kind of find his way back. We had a tracking device on him. But from this experience, we learned that certain tracking devices only work around other cellular devices. They're Bluetooth devices. So if you're in the woods and there's no cell phone or iPad around you, then nobody can track you.
Wow.
So we were waiting for him to come home. He had never been gone from home for more than like 3 hours. And usually we just do the same routes, follow the same streets to find him. But he just kept going back to this particular park. So at about 6 o'clock is when I realized that he wasn't there. When we looked at the neighbor's Ring camera, it wasn't even 10 minutes that I started like looking for him. And you can see me looking for him on the camera as well. But he was gone by that time. My mom came home around 9 something. So we're thinking like holding our breath. He's going to be home. He's going to be home. By the next morning, 7 o'clock in the morning, we just kept going back to the park, calling his name. That's when I started posting the videos on Instagram and saying, hey guys, I need help looking for my dad, like he's gone. And that's when people, strangers started coming, sending me messages, trying to figure out how they could be of help. People from my practice, different clients that we have in different facets of the business started showing up at the park looking for him. And we battled with the authorities because they said, well, maybe he got on the bus, because the dogs that they had looking for him, sniffing for him, kept stopping at a particular part of the park. So they say he must have gotten on the bus. We have to wait until the bus, this was on a Friday, until they open again on Monday.
Oh, no.
They were saying they would have to wait. So we made flyers. We had volunteers going out. We started looking for people who had connections with the bus, with the metro, so we could get the video footage which we did before the police did.
Right.
Where I was passing out flyers in different places. We had a lot of volunteers that were doing this. At Home Depot, I was going out and handing out flyers. I found this one wonderful woman who does horseback riding lessons. She came out with her horses and people looking for my father in the woods. Even though the authorities were saying he wasn't there, the community that we built, the community that responded because we asked for the help, came out and were looking for him. They believed us that he was in that park. And that's where he was found, in that park 5 days later. That park.
5 days. I can't even imagine.
Yeah.
So wait, this must be a huge park for him to have been gone for 5 days.
Listen, it is. And I did a video also from like the aerial view. And the park is a couple of miles long, and it actually stretches across a couple of cities. There are trails that go through the park and then main roads. And then the trail picks up on the other side. So we had people on all sides of this park looking for him, but he was in that first section near my parents' house, but a mile or so into the woods. He just, of course, he can't tell us what he was doing in the park during that time, but he survived that 5 days and 4 nights. We attribute that to God, of course, but also that military training. I said, I don't know what he tapped into while he was back there, or where he thought he was going. But yeah, when they found him, he was, we have since reunited with the rescue dog Puma that found him in the woods.
Because my next question was going to be, how was he found? Who found him?
Yeah, Puma, the rescue dog, found him, and her handler, that was actually her first rescue mission. Yeah, so they found him. They let Puma out into the woods. Puma went and found him. And then they said Puma came back to them, like with what the sign that she does, the bark that she does. And they followed her in, and he was laying on the ground. And if that July 11th weekend, it was so hot. One of the nights it was raining. We went door to door asking people throughout the neighborhoods to look at their Ring camera footage. People were coming from different states. We had so many donations coming in to help us, because I was very transparent about how much it was costing us for these big banners that we were putting on the highway, on the road, for people to find him. But the community really came through for us. And that's part of why I'm on a mission this year with this community wellness, because a lot of times we go through things, and as we were for a couple of years before this, when he would go missing, my sister and I would leave work, my husband would leave work, and we would just go find him. We would just look for him for hours, and we weren't asking for help. We weren't telling people what was happening. So by the time this happened, and it's a traumatic event. Even my young sons, they don't know any better. They're just transparent. A lot of times when they see my dad, they'll say, now, Pop, don't go get lost in the woods. because mommy didn't come home when you were lost in the woods. Because
Oh,
I was
of course.
out the house before they got up, and I was still
Mm-hmm.
gone when they would go to sleep for those 5 days.
Wow. And
Trying to find
trying to
him.
find when
Hmm.
they found him, I'm sure he had some health concerns, but pretty much okay.
Yeah, he was dehydrated.
Mm-hmm.
They found some blood. He must have hit his head
Mm.
then or sometime very, very recently. So
Mm-hmm.
they kept him overnight at the hospital for 2 nights.
Okay.
Um, but even with that at the hospital, because he looked fine,
Mm-hmm.
I mean, he looked like he was dehydrated, but my mother just insisted, please run all the tests, please scan that
Of
brain,
course.
please see what's
Mm-hmm.
going on with
Mm-hmm.
him. But thankful that overall he was okay. Yeah.
Wow.
Yeah.
That that's definitely a testimony. Mm.
Mm-hmm. Mm-hmm.
Wow, God is good.
Absolutely. Absolutely.
Mm-hmm. Mm-hmm. So your father has dementia.
Mm-hmm.
Your mom is the primary caregiver. You and your sister support her. How has that experience been?
Uh, talking about anxiety and stress,
Mm,
the anxiety around someone with dementia who I'll say is a flight risk. That
mm,
anxiety is a round the clock experience.
mm,
And when you're not talking about what's happening and not actively using resources that might be there, it's very tough to live your life.
mm,
My mom was very active, and she's starting to transition back to it.
mm,
But was very active in her religious community, but with my father, and very independent of my father. But with him, with his symptoms deteriorating, with him getting worse, she really has found herself over the last couple of years being in the house more
mm,
and
mm.
not wanting to ask for help, even for us.
Right.
The stress of my younger sister and I really, in hindsight, like trying to force her to get certain help, that caused some tension in our relationship. And that's
Okay.
part of why I've been, so vocal about anxiety, stress, trauma in situations even like this,
Mm-hmm.
because you want to have a foundation of healthy communication or learn strategies for healthy communication when you are caring for a loved one.
Mm-hmm.
Um, if you're not used to asking for help, it doesn't just come
Yeah.
immediately. That now
Mm-hmm.
that your husband's sick, now that your father's sick, you're asking for help.
Yeah. And that
Um,
generation, they're so used to doing things on their own. And I'm sure
Absolutely.
that's my husband. I'm going to take care of my husband. It's a generational thing as well.
Yeah, yeah,
Mm-hmm.
absolutely. Absolutely. So, for us, even our input with, well, we think that care should go this way, and us trying to take over the days so we can kind of take over what's happening with his care,
Mm-hmm.
with really good intentions, we learned that the caregiver, the primary caregiver, because my mom would say that to us, like, you all are helping me. You're not here all the time. So
Right.
you don't know what's
Mm-hmm.
happening. But listen, we think we know what's best because we're leaving work to go find them while
Mm-hmm. Mm-hmm.
when you have a daycare or when you're trying to do other things. Um, but really that cohesiveness in families is necessary. I have talked to many families over this last almost year that relationships have fallen apart because some family members think things should go one way and some family members think things should go another way. I keep mentioning my younger sister. My father has 7 children.
Mm-hmm. Mm-hmm.
So my sister and I are very active,
Yeah.
but his other 5 children, not so much.
Mm-hmm.
That doesn't mean that they don't play a part in helping or supporting, but we're the ones who are closest. And so we're the ones that are more hands-on, taking shifts,
Yep.
And alleviating what my mom is doing as far as caregiving. So the anxiety is high. I've talked to a lot of family members also who don't know where to start when their family members get sick and when their family members leave the home. It kind of comes unexpectedly for a lot of, I just spoke with a family 2 weeks ago whose aunt just left the house, and somebody at a nearby liquor store saw her and felt like she looked a little disheveled and picked her up, looked through her things to find her address, and then brought her home. She's experiencing dementia, but she had never left like that before. So, that caregiving process, as you and I had been talking about before, sometimes it blindsides you, and people aren't prepared for the things that come with dementia. We really just know memory loss, right? Yep. But we don't know, a lot of us don't know about the things that happen, like the bowels that stop moving, or the ability to walk decreasing. Like there are these things that I think conversations like this are really important for us so that people can be prepared for what comes with this disease.
Absolutely. And one of the themes that I discovered when I did my research was that caregivers are not prepared. There's no training. Usually you're put in this situation because of an experience or, a diagnosis. And it's like, okay, I have to do what I have to do to take care of my family member, but they're not prepared. And I remember during my interview process, one of my participants said she doesn't think that anything could ever prepare you for being a caregiver of a person with dementia, a loved one with dementia. So it really is important. And something you said was key, the resources, knowing the resources, knowing what's available. And again, that's why I'm doing this podcast, to really just to be able to share resources. I've been there, and I want to be able to help anyone who's going through this journey, because it can be a very difficult journey and a lonely journey. You mentioned the isolation piece, your mom, staying home now. It can be very isolating as well. So I know you do a lot on trauma, stress, anxiety, and caregivers of dementia experience higher rates of trauma, stress, anxiety. What do you say to caregivers who are experiencing some of these phenomena that go along with caregiving?
Yeah. I'd encourage caregivers to seek out support. Now, that could be, in your religious community. It could be a Facebook group on caregiving. It could be a local therapist that you might be able to talk to. There can be a lot of guilt around caregiving because, why do I feel stressed? Why am I like, this is my duty to take care of my mom, to take care of my husband, to take care of my grandparent. And so a lot of times we really want to think about what our own values are, what we have been taught about caregiving. I think one of the biggest things is that we have conversations about like what to do if I die. Where do you want to be buried? Do you want to be cremated? What do you want your funeral service to be like? Do you have a will? But I think we skip the conversation of what do you all do if I get sick?
Right.
And how do you care for me? Am I okay with you getting help? And I see that being a lot of the guilt with caregivers, even that I have in my private practice from mental health support, is, I don't want to get help because I should be able to. So that's one of the biggest pieces of advice is debunking that theory that you should be able to do everything. We want you to get help. There are resources, even with stuff like care.com. And just like with kids, we know that you're hesitant to get, somebody else to come in and help. Okay. So I don't want to minimize that factor, but the impact of anxiety on your body, the impact of stress on your body, it really eats at you from the inside out. And we want you as caregivers or supporters of caregivers to take care of yourselves so that you can really offer your best to those who you're taking care of. I appreciate my mom giving me permission, because she's a very private person, giving me permission to talk about these things, because the experience we had with our father last year, when gone for 5 days and 4 nights, she had a lot of time to reflect. And as she prepared the home, you have what you say. And my mom kept cleaning the house, arranging his shoes, making sure that when he came back, because we kept speaking it, when he came back, he would be welcomed back into the home. But we were able to talk about her levels of stress. And she was able to think about maybe times that she was a little too snappy, or times that she could have handled things differently. And we don't want you to have a traumatic experience to come to the realization that, man, I need a break sometimes. I need to let these daughters come in and take a shift or two.
I need some help. This is a lot.
Yeah. So definitely, preparing your pride for help so that your body can benefit from the help. That's, just top tier what we need caregivers to do, because the statistics around abuse for those who are being cared for, we have some research around it, but a lot of times we don't find out about those things until after the fact, or until there have been some impacts, some effects of that. Because the people we're caring for can't really talk. They can't, tell us what's happening. So to save your sanity, take the help. Yeah.
So you mentioned the caregiver's guilt. And I don't know if you saw it on my face. Oh, I was holding. I really had to hold the tears back, because it was something I really went through. And my mom has been deceased 8 years now. It'll be 9 years. And, looking back at the time, I had 2 young kids, recently married, in school, working on my doctorate, working full time, running a nonprofit organization as the president. But I kept saying, and I felt so guilty. Is it fair for me to give up my life for my mom who's already lived her life? So I know that guilt.
Oh, I got chills.
Oh, I'm telling you, I struggle with it. Thank God my husband is a psychologist and he was able to talk me through it. But it is so real. The guilt you feel sometimes, this is too much. I can't do this.
Yeah.
But again, you know that you have that, well, a lot of us, that sense of obligation and responsibility and duty to care for our loved ones. So definitely seek support, seek help. You go through a range of emotions as a caregiver, and it's so important that you have the support and the resources in the community, as you mentioned. And it's important that you take advantage of it.
Yeah. Yeah.
You have to sometimes say, I can't do this right now. I need a break. And it's okay.
Yeah.
It's okay.
Yeah. I think that's key. What you said is to say it, because a lot of people battle with, well, they know I'm taking care of mom. She has other kids. Well, where are they? They know. But sometimes, caregivers make this thing look easy, truly, from the outside. Dad is always clean shaven. He always has on nice clothes. Mom still does his manicures and pedicures. She makes it look seamless. But
Right.
we know behind the scenes
Mm-hmm.
all of the small nuances that go into it. And then if you're working, if you have a
Yeah.
family, if you're in
Yeah.
school,
Mm-hmm.
even the financial part
Yes.
of taking care. And you have to tell people that you need the help. You
That's
can't
right.
expect people to know. And I've
Mm-hmm.
heard so many people say it's common sense that that I need help, but
What do they say?
you
Common sense
got
is not that
it's not
common.
common. You
Mm-hmm.
gotta
Mm-hmm.
say it.
You
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 have to say
do.
it.
Mm-hmm.
Mm-hmm.
Because like you said, people think it looks easy from the outside, or you're doing such a good job that people don't realize that you need the help, but you have to. So, note to the caregivers who are watching this podcast, when you need a break, say it, ask for the
Mm-hmm.
help. Don't be ashamed. Don't be embarrassed. I
Mm-hmm.
always say you have to put on your oxygen mask first.
Yeah.
So you have to take care of yourself first.
Yeah.
So what I know you have your counseling practice.
Mm-hmm.
What supports do or resources or um, guidance do you give to caregivers?
Yeah. With my practice specifically, so I'm licensed in DC, Maryland, and Virginia, and
Mhm.
every county has municipal centers, resources for adult daycares. Through your insurance company, there are home health aides, and
Mhm.
that's where some of that financial part comes in. But we have support teams throughout the county, and a lot of people are eligible for these services through Medicare. Some with military benefits are able to take advantage of some of these opportunities. Even the adult daycare centers, I encourage you to tour some of the
Mhm.
places in your county because being able to have your loved one be at a center, even for a couple of hours a week, may provide you with some reprieve
Yeah.
to go. I mean, getting a simple cup of coffee, being
Mhm.
able to go to the grocery store without the anxiety of them falling, them
Mhm.
leaving. But counties, especially in Maryland and Virginia, have those resources for
Mhm.
some reprieve. Again, the home health aides, the reason why I kind of smirk when I say that is because of the care.com thing that I said. I even spoke with someone earlier today. We were talking about the home health aides, and she was like, I don't know. I don't want somebody in my house though.
Mhm.
And
Mhm.
understood. Some of that is a pride thing, a privacy thing, but the long-term benefit of taking care of yourself is what I continue to talk to people about. So
Mhm.
call your insurance company or your loved one's insurance company and ask what resources are available to me? Which providers can I go to that specialize in dementia care or, whatever your loved
Mhm.
one is battling with? Because there are resources to take advantage of. And then going to a mental health clinician, one of our duties is to help support through resources. So if we can't provide the support, we are supposed to help you find somebody who can
Mhm.
help you get the support.
Mhm.
So, find a good clinician. I always put out on my Instagram or on our social media, on our website, our office number, because no matter where you are in the US, we will help you connect with somebody who
Mhm.
can help you with getting resources. Um, so we know that it's not easy sometimes to ask for the help,
Mhm.
but there's help out there
Help
for
is
us to,
available.
yeah, for even
Mhm.
a small snippet of reprieve. Yeah.
Right, right. My mom used to go to a daycare program, and at first she didn't want to go. She didn't want to go, but then we called the school And then
Look at
she loved
that.
going to school. She would be ready. Am I going to school today? I
Oh,
mean, she
wow.
loved it. But at first it was, no, I don't want to go. But after a while, she loved it. And yeah, there are resources available. So you mentioned calling your office
Yeah.
or what you do. So shameless plugs. Tell us how to get in contact with you if anyone is interested.
Yes, thank you. So my company is called Nurturing Possibilities. The website is nurturingpossibilitiesllc.com. We advertise for postpartum service support in the same way we can find that type of support for loved ones who you are caregiving for.
Mhm.
So the phone number is 301-744-8161. You can contact us by text or call, but if you let us know where you are and the resources that you're looking for, we call it a warm handoff. We will figure out who we can warmly hand you off to. We do not
Mhm.
just give you like a list of resources
Numbers
for
and say,
you
go
to
figure it out. Hmm.
know, because a lot of times when we call, it's an operator or they have a wait list, they're not taking new people, and it's already frustrated enough
Right,
and hard
right.
enough to call. So
Hmm.
we do walk you through that process and share that process with you, so that we can help you find somebody. Really, the point is to help people maintain their sanity, and we're so used to having to take care of that ourselves, but we want to support the community wellness for our sanity is what we're looking for. So, we'll become part of your community, but you got to reach out so that we
Hmm.
can help you. So we know that you need the help. Yeah.
Absolutely. And I'll be sure to put your number and your email on the screen so that the
Thank
Beyond the
you.
Care family can reach out to you. Any last words of advice to caregivers or anything you'd like to
Oh,
say?
yeah. I think in preparing for being a caregiver, have conversations with your family. A lot of times we prepare like with insurance policies and stuff like that. We prepare for, again, what to do when you die, but the financial heaviness of caregiving can be tough, and we just don't talk about that enough.
Mm-hmm.
So don't just talk about what to do when you've gone on to glory. Let's talk
Mm-hmm.
about, money that we're putting aside. How do we save money for my potential caregiving in the future?
Mm-hmm.
But if we are already caregiving, I just hope that you can try to share the weight of that with community. When I talked about those Facebook groups, these Facebook groups have a lot of people with a lot of opinions, and those opinions come with resources.
Mm-hmm. Mm-hmm.
So, getting into those caregiver groups on Facebook,
Mm-hmm.
people have all types of resources that they will tell you about. But
That's true.
again, you got to ask for it. Even in those
Mm-hmm.
groups, you have to say, "Hey, I'm in Detroit. I
Right,
need
right.
help for my
Mm-hmm.
mom who has dementia. Who has a resource?" But these groups are really helpful. So if you don't want to travel out to a group, if you're,
Mm-hmm.
stuck with the blizzard, this winter weather that we've been getting, get on Facebook, find some
Yeah.
help. And I just hope that people really start to normalize asking for help and taking the help.
Mm-hmm. Awesome. Awesome advice. And yes, those Facebook groups are really good sources of information. I'm still in a lot of the groups.
Yeah.
So your the key theme, ask for help. Don't
Mm-hmm.
be afraid to ask for help when you need it. Dr. Dix, thank you.
Thank you, Doc.
Thank you for being on, for sharing your experience, for sharing your expertise. I appreciate it. I'm going to have you back on again because I feel like
Thank
we
you.
just touched the surface. And I'm sure there's so much more we can talk about. And I'm really interested in your piece about misdiagnosis.
Oh, yes,
Um,
yes,
yeah,
yes.
I saw you did something about that, and I do still follow you on Facebook. I mean, on
Thank
Instagram.
you.
Your father's
Yes.
very cute.
Thank you.
Um, so thank you for pouring into our Beyond the Care podcast family. I'm sure that's something that you said will resonate with them. And
Thank you.
I hope that if they're in need, they will reach out to you. And we appreciate you.
Thank you. It has been an honor. I appreciate you, Doc.
Thanks. Take care.
Thank you.